Hello everybody and welcome back to my blog. Thanks for watching as always. So this week I'm doing a topic that I've had several email requests about and I've always kind of avoided it a little bit, but that's purely because the significant other in my life is actually an expert in this field. So obviously lots of pressure. So what am I going to cover? Sciatica. So I guess the first question is what is sciatica? Because is it a disease process? Is it just a general name? And the answer is yes, it's just a general name. So it's a description of symptoms and it's not a diagnosis in itself, but an umbrella term to cover off the symptoms that you get from a whole range of underlying medical conditions. And it's characterised by pain, and that pain can be stabbing, burning, shooting, weakness, so that's something else that you can get with sciatica, pins and needles or numbness, and usually it's in the backside, your bottom, down the backs of your thighs, backs of your calves, into your ankles and feet and toes. So it's all of those symptoms running right the way from your bottom down to the tips of your toes, and it can be anywhere along there. It can just be in your toes, it can just be in your bottom. And it's usually only found on one side when it happens. So what are the underlying conditions that can lead to these symptoms that we call sciatica? So a herniated disc in the lumbar region of the spine. So that's in the last 5 vertebrae of the spine. If you've got what people commonly call a slip disc, and that's where the disc that's between the 2 vertebrae actually starts to poke out and it starts to touch your spinal cord. So that's a herniated disc, and that's a really common cause. Degenerative disc disease, which happens to us over time as we get older and we get osteoarthritis and things just don't work quite as well as they used to. Spondylolisthesis, which is easier to say than it is to spell. And that's where 2 of your vertebrae, sitting one on top of each other in your spine, one of them slips forward over the other one. And of course that means that the hole that runs down the middle where your spinal cord is gets smaller. Something called piriformis syndrome, which is where your sciatic nerve runs under a ligament called the piriformis, a muscle called the piriformis, and it gets squashed there. And sacroiliac joint dysfunction. So in our pelvis or our hips, that's the whole bone that forms our hips, there are 2 joints at the back called sacroiliac joints, and if there's a problem with those, they too can cause the same kind of symptoms. So as you can see, there's lots of different things, and there's probably more as well, that lead to the condition called sciatica. So what's the process? What's causing the problem? Well, the sciatic nerve is the largest single nerve in the body. It's probably as big as my little finger, and that's quite big for a nerve. And it's a collection of nerves that come out of the spine along nerve roots. So they come up between the gaps in the spine where they're meant to, and then they all join together to form that nerve. And basically they're all running to the lower half of your body, your legs, your ankles, and they're transmitting pain, signals for muscles to move, and all of the things that nerves do. So anything that goes wrong with that nerve or causes it to be irritable can cause these symptoms. Any pressure anywhere on one of those nerve roots as it comes out of the spine, and I'll put a diagram of this if I can, or a link to a diagram in the comments at the back so that you can fully understand what's going on, because it's hard to envisage with me just describing it. But if these were your vertebrae, coming out between them are nerves like this from nerve roots, and then they all join together and form the sciatic nerve. And wherever the impingement is, because that's what it's called, an impingement means touching a nerve, pinching a nerve, wherever that is in those different areas where the roots come out will cause the symptom. So that will dictate whether you're getting the pain at your toes or in your bottom. So who gets sciatica? Well, it's very, very rare in someone under 20. I'm told by a person who really knows. Under 15, it's just not seen. It's also rare to get your first ever bout of sciatica over the age of 55. So it's more commonly in the middle ages as we start to get some wear and tear. Estimates vary as to how many people actually get sciatica, but they look around 43% of the population have it at any one time, or a form of it at some point in their life. So that's a lot of people. That's 4 to 5 out of 10 people will get sciatica at some point in their lives. And it develops over time. So once you've got it, it tends to keep waxing and waning, coming back, getting slightly worse. And we'll talk about that later. So there are other things which make you more susceptible to sciatica. So being pregnant, because everything's just a little bit looser because of the progesterone you've got in the body, but also you've got the weight of a uterus with a baby in it sitting down there. Scar tissue in the area, so epidural fibrosis is what it's called, will also make you more susceptible. A muscle strain or spasm, and this is why we always talk to people about keeping moving so that the muscles don't go into spasm when you have an injury there. If you've got a spinal tumour, if you've got an infection in your spinal column, if you've got a fracture, and if you've got a condition called ankylosing spondylitis, these things make you more susceptible to sciatica. Some people believe, and not all by far, so this is very controversial, that being overweight can make you more susceptible, and smoking seems to make people more susceptible. So as doctors, how do we investigate and diagnose sciatica? Well, in the main, it's a clinical diagnosis, and what that means is you'll go and see your doctor, your GP, and you'll tell your story. They'll examine you in the room just to see what signs that they can elicit by feeling over your bones, getting you to do certain movements, testing your reflexes if necessary, and asking you some questions to rule out any red flags, and I'll cover those later. And from there they can diagnose sciatica. And it's really only if you get further down the line and the conservative treatments are not working, will your doctor then refer you for some imaging. And initially that could be an X-ray to see whether or not you've got osteoarthritis in your spine, degenerative bone disease. And ideally it will be for an MRI, because an MRI will look at all of the nerves as they come out of the vertebrae to see exactly where the impingement is and what's going on. But that is about it in terms of investigations, and generally you don't get to that point of needing an MRI. So is there treatment? Of course. And what is the treatment? Well, as usual with these kind of things, we can divide the treatment into 3 areas. So conservative, non-invasive and surgery. So conservative, most of the time when we see somebody experience low back pain, because it's in the bottom half of your spinal column, low back pain for the first time, or they haven't had it for a while, it's a new flare, we just sit and watch and wait, because we know that most will get better within 6 to 8 weeks. In that time, obviously, you need to be comfortable, so we use analgesia, painkillers, to help keep the pain away, and we encourage people to move. So as I said earlier, gentle mobilisation to make sure the muscles don't go into spasm. So when you do have this kind of back pain, the worst thing you can do is just stay rigid and still. And heat and ice can help, as well as with any soft tissue injury. So that's the conservative, and 99% of cases will get better on their own gradually over 6 to 8 weeks. Even if it is a slipped disc, a herniated disc, because the body is very good at resorbing the bit of the disc which is poking out. It will just chomp away and get rid of that and remodel most of the time, not always. So if it isn't getting better in that time, then what do we do? So this is where we come to the non-invasive treatments. So the first one, which does work quite well for lots of people, is an epidural steroid injection. And this is where steroid is actually injected to the area around the disc where there's a problem, or around the vertebra where the problem is coming from, so where the root or the nerve is being pinched. Some people get relief then for a week. I know that's not very much, but that's probably just the local anaesthetic, that bit, all the way up to a year. And it's completely unpredictable. So as I've said, for some people it works really, really well, but for others not so well. But it's fairly non-invasive, so you haven't got that much to lose by having those. Manual manipulation, so seeing people like osteopaths, chiropractors, really good sports physios to manipulate the area to try and help, and that often is enough to just sort things out. Massage therapy, again, just working the area to just break up any spasms or muscle strain. Exercise, so gentle exercise, usually I would say guided by a physio to help you do the right thing. But I'm also going to put a link at the end to a superb exercise site that I'm going to talk about just now. And CBT, cognitive behaviour therapy, which if you've got chronic sciatica, which is ongoing and really interfering with life, it's actually just a way of just coping mechanisms, learning coping mechanisms and different ways to deal with the pain. And we often use CBT with chronic pain. So that's not an outrageous suggestion to make, and it is something that is used with some success for some people. And as with anything, it's finding what works for you. So what if it's not working? You've tried the conservative watch and wait, you've tried the non-invasive methods, but still you're riddled with this pain, which can stop people actually functioning day to day. It can be that bad. Then what do? Well, then we go to surgery, because surgery is always a last resort for any treatment because it's more invasive and there are more risks. And in spinal surgery, when we're talking about sciatica, there is a surgery called decompression, basically, which is another umbrella term for different types of surgery to solve the problem. And your surgeon will work out from MRIs of the spinal cord, which will show him what's going on, what you need. Because he can see where the nerve is being compressed and why the nerve is being compressed, and from there will recommend the right surgery for you. So there are basically two types of surgery. So there's a microdiscectomy, so when you've got a slipped disc or a disc herniation that the body isn't sorting out and isn't resorbing, the surgeon will go in and take away the segment of disc which is poking out and touching the nerve and causing problems. Then if the problem happens to be something like spinal stenosis, where there's a narrowing of the area where the nerve runs, be that the spinal cord or the nerve root, the surgeon will go in and do a lumbar laminectomy, whereby they take away the debris and any bone overgrowth, which is actually making that space smaller. And once that's happened and the nerve has more room, hopefully the pain will go away because the nerve isn't being touched by things that it shouldn't be touched by. So those are the two surgeries, and your surgeon will decide which one is best for you. And it's really only at the point of surgery or just before you get referred for either epidural injections or surgery that you would need any investigations. The rest of it a GP can manage, and we know what to look for and the things that would worry us. And only if we reach that point do we then look for some imaging, or if you need to go on further in the treatment process, and then you would have an MRI. So as a GP, what things would worry us? Okay, so this is really important because most sciatica will get better on its own or with very little intervention, but sometimes it's a warning that other things are wrong which are much more serious. So as I said earlier, if you get the first episode of sciatica in someone who is under 15 or over 55, that's a red flag and needs to be investigated straight away. We don't wait the 2 months. If somebody has had previous cancer and suddenly has new onset low back pain, that's a red flag. If there's any weight loss or night sweats, it's important to investigate. If the weakness in the lower legs or the numbness, so any neurology, is getting worse rather than better, we need to find out why. If there's any loss of what we call perineal sensation, so underneath, between, for a woman where she pees and poos, for a man, from really the testicles to where he poos, if that area is numb at all, if you lose control of your bowel or bladder, so your bowel and bladder are opening without you meaning for it to happen and without you noticing that it's happened, that's not a good sign, and we need to check that out as well. And the reason for that is that something called cauda equina could be happening, where the spinal cord is being pressed so tightly that you're losing your nerve power below it. And that's a medical emergency and needs to be seen in A&E straight away, because you've got about 6 hours to free that up and restore the nerve activity. And if you get sciatica down both legs, that's also not such a good sign. So all of those things we would call red flags. And despite all of my earlier talk about how it normally gets better on its own, it normally does. But in a very, very small percentage of cases, there's something else going on that needs urgent treatment. So if any of those things, and I'll list them afterwards in the description, if any of those things happen, then you do need to see someone urgently. So most people get better, but we quite often see that once you've had one episode, then it waxes and wanes and it comes back. And it's not nice and it's debilitating every time it comes back. So what can you do to try and stop it coming back? Well, as I've said, most new onset cases or flares will get better within 2 months. But if you want to stop it from coming back, you need to do some work to strengthen the muscles around your lumbar vertebra. So it's the muscles that hold your spinal column in the shape that they're in, one on top of each other. You need to make those stronger so that the bones don't move around so much and you've got more support from the muscles around. So if anything does happen, it should be less severe and hopefully stops happening altogether. I had something like this about 5 years ago, where my legs, back of my thighs, would seem like they were on fire when I was out shopping, and I'd go into a loo to see if my skin was red, and it was never red. And I had an MRI and I was told that I had degenerative disease of my bones, getting old and lots of activity because I do lots of sport and always have, and I needed to strengthen the muscles around that area, and so I did. I did planks every single day, and don't get disheartened, I could only do it for 20 seconds initially, but after a few months I could do it for 20 minutes, and that just strengthened the muscles. The symptoms went away, and touch wood, I don't have any wood here, touch my head, they never came back. So it's really, really important. Now, I just did planks, but actually since then I've discovered an amazing website, and it's written by an orthopaedic surgeon who actually is one of those refreshing surgeons who believes that surgery should always be a last resort, and if you can do something to get yourself better, then that's what you should do. So he's got a YouTube channel called You, in the letter, Fix You, letter again, and I'll put a link to it in the notes afterwards. But on here, you can pick off what your problem is from the very top of your spine to the bottom. And he's got playlists of exercises that someone shows you how to do. He talks through them, and there's a written description on the screen. And it really is excellent, and it does work. But you need to stick at it. You need to do it every day, just for 5 minutes, for about 2 to 3 months. And it will stop you getting these problems in the future most of the time. So I can't recommend that highly enough. So what else is there to say about sciatica? Well, it's really common. It's totally debilitating for people. You know, it really stops them doing things in life that they need to do, even going to work, getting up, picking up the children, things like that, everyday things. It can be chronic and just keep coming back and coming back with repeated flares, and you can do something about it with exercise if that is you. And don't forget, there are some red flags. So if you've got any of those red flags, and I'll list them afterwards, then your case is urgent and you shouldn't wait the 6 to 8 weeks. You should see somebody and get further investigations. So I really hope that's helped, and I'll see you again in a couple of weeks. Please make any comments underneath and I'll answer them, and if I don't know the answers on this one, I'll ask someone who does. And suggest any comment, any topics that you'd like me to cover, because like this one was a suggestion, I will cover it and I will do the research for you. Okay, take care and keep well.